The recipient receiving a kidney from a live donor has many advantages, but what about the donor? All living kidney donors undergo a comprehensive assessment to minimise the short and long-term risks to them. This sometimes includes a mental health assessment. Why do I need to attend a psychology or psychiatry appointment? Mental health professionals like psychologists or psychiatrists work alongside transplant coordinators, nurses and medical consultants in the West and East of Scotland renal transplant services. The Living Donor Centre you attend will explain when you require an assessment with a mental health clinician because you're considering being a living kidney donor. National guidelines in the UK and internationally recommend that anyone wishing to donate to someone they do not know, i.e. as an altruistic donor, should be offered an assessment with a mental health professional as part of considering if living donation is appropriate for them. We will also offer an assessment to donors with a direct relationship to a potential recipient who present with current or past mental health difficulties and/or issues with substance addiction or misuse. Finally, younger donors, specifically those under the age of 25, will also be referred for assessment. It is important for us to carefully think about donation with younger donors because they have even more life years ahead of them, and the risk of developing diseases that may affect the kidneys in later life must be thought about very carefully. However, provided that the young person is carefully assessed and fully understand their individual risk, age alone should not prevent someone from being considered for donation. Aim of the assessment. The purpose of assessment with psychology or psychiatry is similar to how the wider transplant team complete the medical screening, by looking at blood or scan results. As a service, we want to keep the potential physical and psychological risks related to donation as low as possible. Importantly, it has been found that some people can struggle with the donation process, either before or sometimes afterwards, given experiences they have had in their earlier life, current stresses, or how they try and cope in times of difficulty. The experience of being a potential kidney donor is different for everyone. Being referred for a mental health assessment is not in any way a judgment of you or intended to be discriminatory. The assessment is there to support your best interests in considering this decision. Donating a kidney can be a very emotional process, and we want to make sure that the risk of any psychological harm to you is acceptably small. This is all to get a better understanding of how you think the donation process could affect your life and how you would cope. Ultimately, the mental health professional wants to make sure that you're prepared for the demands of this process.